I'm Dr. Shaun Parson, board-certified plastic surgeon from Scottsdale, Arizona, and I'm answering frequently asked questions. And one question that comes up all the time is liposuction. There's so many different things to think about when we talk about liposuction, what different kinds of liposuction, and there are all these different terms floating around. So let me try to break it down. Liposuction is basically putting a thin hollow tube, usually a metal tube, and sucking out fat. It's no more complicated than that. Now, we have different tips on the end of these tubes. So we have ultrasonic tips or we have laser tips. So the ultrasonic tips are called ultrasonic liposuction. And if it's a redo liposuction, if it's fibrous, if it's a guy and they have sometimes more fibrosity in their chest, we'll maybe sometimes recommend ultrasonic. Smart liposuction is when it's a laser tip, and so that provides some heat energy and that helps to shrink the skin. So if we have a little bit of extra skin in addition to the fat, that's a way to handle those cases. That's really as basic as it is. We also do something that's very common now called Tumescent liposuction, which really occurs all across the board with all the different types of liposuction. And that's where we pre-inject some fluid that has numbing medicine, and it also has some medicine that shrinks the blood vessels so we don't have bleeding. And that's called Tumescent liposuction. And so that's standard of care, the thin hollow metal tube, standard of care. And then sometimes there's different tips that provide specialty situations so that we can deal with a specific area that's in question. When do we get back from liposuction? Liposuction shouldn't take any more than 10 days, 14 days, and you really are back at normal activity. Swelling takes a while to go away, usually 3 to 6 months. Hopefully that helps.